that you wanna be. Tell me where you wanna travel. Do you believe in luxury? What's your hidden passion? What makes you so unique? Conversations with Nicole. Conversations with Nicole. Conversations with Nicole. Conversations with Nicole.
Greetings. Welcome to Conversations with Nicole, a talk show focused on connecting the community through conversations. I am Nicole Everett, your host. And today we are talking about mental illness and mental mental wellness, specifically around law enforcement, public safety professionals, and trauma-informed care policing. Trauma-informed care policing. I don't know if you've ever heard of that term, but I think my guest today is really kind of coined that phrase, and hopefully you'll hear more about that, not only on this live, but in the community. So before we get started with me introducing my guest, I need to know where you are tuning in from. This is an interactive live, so we are looking forward to your comments, your questions, but in the comments, if you will, just put your city and state, so we can give you a shout out. And again, we want to hear from you, your comments, your questions as it relates to mental health and wellness for public safety professionals, as well as trauma-informed care policing. This is Mental Illness Awareness Week, for those of you who may not be aware of that. And so we have tried to focus on highlighting mental illness issues in the community. The gentleman who is my guest today, I had the very distinct pleasure and honor to do a ride along with him on New Year's Eve, this past December 31st, 2019. And boy, it was quite an experience, one that I won't soon forget. But I was so impressed with him and, all that he had to say. He is a 20-year veteran with the Tallahassee Police Department, and he's an author. He has actually written about the very topic that we are about to dive into. So, I feel like it was divine that we were connected in this way. So I'm super excited to have him here today. I see you, Cheryl, from Chicago, Illinois. Appreciate you being with us today. So without further ado, allow me to introduce Officer Arthur Sean Wyman. Yay! Welcome.
Thank you for such an awesome introduction too. You are amazing. Thank you.
You are
Can you hear me?
You are so very welcome. So yes, I can. It was a little bit of a delay, but we'll work through that. So,
okay.
When I did my ride along, one of the things that we talked about was, well, immediately I asked about self-care, because that was my concern about law enforcement. You shared with me that suicide was high amongst law enforcement, amongst officers. So talk to me a little bit about that.
Well, basically, suicide is one of the highest.
Hold on one moment. You know what? I'm so excited to get into the topic. I didn't have you introduce yourself. So tell the folks about you. We need to know about you. So tell them where you're from, what you do. I mean, yes, you're an officer, but what you do specifically and who you are. Tell them who you are.
Okay, sure. Thank you. So my name is Sean Wyman. I am a 20-year law enforcement veteran. I'm an 18-year trainer in high liability between firearms and defensive tactics. I am a father of 3 beautiful children. I'm married to my wife for 15 years. I'm a best-selling author for not 1, but 2 books. One is an award-selling book. I just recently received the Back the Blue Award by Attorney General Ashley Moody, and was presented that in the governor's office, which was absolutely incredible. And my passion my passion is our company that we started called Going Beyond the Call, that really focuses on preparing public safety for the social emotional aspects of the job that they're not trained for when they get started.
Hmm. Awesome. So I purchased Sean's book, which is there we go. All right, having a little technical difficulty, so bear with us. But it is full of information that I was previously not aware of, as it relates to mental health and public safety professionals. So again, let's dive in. I asked you about self-care, and you informed me that suicide was relatively high amongst law enforcement, and something that does not get talked about at all. I mean, I've never heard of an officer committing suicide before. So talk to us a little bit about that.
Absolutely. So over the last several years, just in the state of Florida alone, we've been in the top of the ranks when it comes to law enforcement suicides. We were in the top 5 for the last 6 years, and the top 3 for the last 3 years. And you're right, there isn't a lot of conversation about it. I believe that one of the biggest challenges is that we deal with high liability when we focus on our training. We focus on how to shoot. We focus on how to drive effectively. We focus on, defensive tactics and being able to protect ourselves. Yet the number one thing that kills us is ourselves. Let me let that sink in for a minute. We kill ourselves more by our own hand than anything else that we train for that should and could kill us. You there, Nicole? You there, Nicole? Nicole? Hello? Nicole? Hello? Nicole?
Okay. Don't know what is going on with our connection today, but let's try it again.
Okay.
Okay.
Did
So
you hear what I said?
I heard some of it. So you were saying that, law enforcement does certain training and tactics and that sort of thing, and that's kind of where it got cut off.
Okay. So
Yeah.
basically, we kill ourselves more than anything else we train for that could kill us across the country as of 2019.
Mm-hmm. Gotcha. All right. So, that's pretty devastating to hear, but I think that what maybe your layman or, general population might not realize is that how much you all take on in dealing with the public and the pressures of the job and that sort of thing. Right.
I agree. We train on the high liability topics a large majority of our training time. And we don't spend a lot of time really focused on the social, emotional, and mental aspects of ourselves, of the communities that we serve. And I think that's where the challenge really lies, because we kind of get mentally ambushed as we go out there, and we're starting to have to learn how to deal with these social emotional issues that, I
Mm-hmm.
mean, frankly, I didn't know how to deal with those things when I started at 27 years old. I see
Right.
a lot of new officers that don't know how to deal with those things. Matter of fact, I'd say the large majority of us had not seen a lot of the things that we go out and we end up seeing, day in and day out over the course of our careers.
Mm-hmm.
So I think the challenge is, really just emphasizing again
Right.
the lack of training when it comes to dealing with the social emotional aspects of what we deal with 90% of the time. 90% of the time, we are dealing with other people's problems, and are challenged with trying to figure out how to address those situations, whether it's an abuse situation, it's an alcohol addiction
Mm-hmm.
or drug addiction or mental health, or whatever the case may be. The training needs to be better when it comes to that.
Absolutely. So, what recommendations would you have training wise as it relates to that?
Oh, so glad you asked, because I feel like there's a very simple solution that just, I mean, I've been shouting it from the rooftops for a while now, but it's called trauma informed care policing. And trauma informed care is not my idea. It's been around for a long, long time
Mm-hmm.
in the social services networks. The problem is lack of implementation. And what we need to be able to do is we need to be able to bring the trauma informed care principles that have been created over a long time
Mm-hmm.
and adopt them into our police philosophies. So the way that we're interacting with people, recognizing, specific things, identifying trauma both within the people that we're interacting with as well as within ourselves.
Mm-hmm.
Understanding that the way that we speak to people can trigger them, and the way that they speak to us can trigger us, and
Mm-hmm.
us being able to recognize when we are being triggered so that we over uh, don't over emotionalize situations, and we're able to stay rational even in the most emotional situations, because we understand that rationality is that's far more superior over somebody who's in a high emotional state.
Mm-hmm.
So I mean, trauma informed care is a pretty simple principle. It focuses on understanding trauma and how trauma affects us mentally, physically, psychologically, spiritually, right?
Right.
Understanding how it affects our communities in the same aspect. The informed side is having the information to understand when things are happening, to realize, to recognize, to be able to respond, and really to avoid re traumatizing other people that we're interacting with when we do recognize that there's a deeper situation there. And here's the best part: it's about not focusing on what's wrong with people, it's
Mm-hmm.
focusing on what happened to people that
Mm-hmm.
led them to the moment that we are in when we come into that interaction with them, so we can actually start to be the not only the first line of defense, as far as protecting people, we can also be recognized as the first line of healing, because we're the first ones to interact with them when they're in those high emotional states, and we can help them to identify resources and opportunities that are available to help them to go back and deal with those post traumatic situations, whatever they were. Maybe they were an adverse childhood experience, or maybe there was something that just recently happened, whatever the case may be. But we are able to identify that,
Mm-hmm.
offer resources, and actually help them and address the situation, so we don't have to keep going over and over and over again to deal with the same situations and same problems.
Whew, you have said a lot there. And actually, as you mentioned all of that, again, I'm going to have to go back to the ride along, because we had one citizen who we engaged with that you masterfully, you know, did what you just described as not what's wrong, but what happened. And the citizen kind of guided you through some of the events of their life. And several of those events were adverse childhood experiences, which explain why they were in the situation that they were today. And many other things that took place from those adverse childhood experience until now that got them to that place. So, I don't really think we really realize how real ACEs or adverse childhood experiences are, and how they really do have an impact on the decision making of adults right here, right now, real time. Um,
Absolutely. ACEs impacts every single one of us on this planet in some way,
yeah.
shape, or another. We have either been involved with somebody with ACEs, or we ourselves have experienced our own ACEs. In layman's terms, ACEs is adverse childhood experiences. So those adverse childhood experiences, especially when they're not dealt
Mhm.
with or they're not addressed, and they're not able to deal with those situations, and they put it in the back of their subconscious brain. Well, what they do is they now position themselves to be re-emotionalized, or what they call triggered, every time a certain circumstance or situation or a trigger word or a smell or something they see, it can come from so many different senses that can trigger the brain to recall that original situation and pull it right back to the front. And all of a sudden, you think you're dealing with a drug addict. What you're actually dealing with was a kid who was mentally and physically abused, and his father was incarcerated in prison for selling drugs. And he didn't know how to deal with that. And he didn't have the resources and the opportunities to be able to go through all those emotions and all those feelings and anger and all those things that he needed to be able to address in order to have the opportunities that he deserved to have but never got.
Absolutely, boy. Whew. I'm about to shout over here, Sean, because, you know, if people really, I hope they really are hearing what you're saying, in that these triggers can occur, and unprocessed trauma, again, leads us to where we are, where these behaviors are occurring because there was no care, right? Or the care was inadequate to help, you know, a child or an adolescent, a young adult deal with things that took place. So, whew, you know, again, this is great that we are having this conversation. And we
Oh, you there, Nicole?
all right, here we go.
Okay.
So, in the book, I'm going to reference the book now, chapter 3. Again, it's Mental Illness Awareness Week. You mentioned that 1 in 6 adults, U.S. adults, experience mental illness within a given year. That's pretty high. And then you further quote, and this is from the Substance Abuse and Mental Health Services Administration, that these you know, this information is coming from. But 6 out of 10 states with the lowest access to mental health care also have the highest rates of incarceration. Can
That's
anybody
right.
guess what those states are? Let me ask. I'm gonna throw this out there to the viewers. Can anybody guess? There's six states, 6 out of 10 states with the lowest access to mental health care. They have the highest rate of incarceration. So in the comments, just let me know, what do you think some of those states might be? And I'm going to call them out in just a minute. But what do you think some of those states might be? But yeah, kind of speak to that as we wait for them to put the comments in.
Absolutely, absolutely. So, I mean, you think about it, right? We have a huge issue in the United States when it comes to mental health. A lot of mental illness isn't even addressed or recognized until a person gets much older. And again, a lot of that comes from where? ACEs, because they weren't, again, adverse childhood experiences that aren't dealt with. They don't know how to cope. They end up going to negative coping mechanisms. Their mind begins to alter, and and the brain, all the brain's trying to do is figure out how to survive. So what happens is a lot of confusion, a lot of frustration, and it can lead to depression. It can lead to mental illness. It can lead to all kinds of crazy things. And the more adverse childhood experiences that you have between birth to 18 years old that don't get addressed, the higher the likelihood of poor health, poverty, potential mental illness, because your brain is not growing and learning and absorbing information the way that it's supposed to, because the brain has a natural survival mechanism where it will just shut down, Nicole. It'll just stop if it has to until it feels like it's safe again, and then it'll open back up. And what a lot of people don't understand with ACEs, it's not the end all be all. Look, I scored a 9 on my ACE test. Okay. It is not the end all be all if you score high on an ACE test. What ends up being the the killer in ACEs is when you do not address those adverse childhood experiences. When you do not go back and identify the problems, the sources, the issues, when you do not go back and forgive the violator, You know,
Yeah.
forgive the people that were involved in those circumstances. And most importantly, Nicole,
Mhm.
forgive yourself.
Absolutely.
Forgive yourself, because we take a lot of blame for things we have absolutely no control over when we're kids. And it's because we're led to believe that it's our fault. It's not
Yeah.
your fault. Look
Yeah.
at me, guys. It's not your fault.
Right.
If you went through adverse challenges at a very young age, there's a high probability it was not your fault. Matter of fact, you had no control over it whatsoever.
Hmm.
Those were decisions and choices that were made by people that were not going to listen to what you had to say. They didn't care about how you felt, and they weren't worried about what was going to be the outcome for you because they were so focused on themselves.
Yes. Yes. Thank you for sharing that. I just want to also make mention of the highest score that you can make on an ACE test is what?
A 10,
Right. So you scored 9 out of
9.
10.
And it took me a long time to come to grips with number 9. I'll be
Mm-hmm.
honest, man. I was really weighing it back and forth. Like, is it? Isn't it? And
Mm-hmm.
and again, you have to have honesty, man. You have to be able to face those demons. You have to be able to look them in the eye and say, hey, you know what? It may have only happened one time, but it happened, and I never addressed it, and I need to address it, right?
Yeah.
And it makes all the difference in the world when you do.
Mm-hmm. Well, thank you for sharing it. Appreciate your transparency. So we have a few people that have commented. We have Dr. Monica who said Florida, Illinois, Alabama, Mississippi, New York, and Texas.
Somebody's Googling.
Almost, not quite, almost. You got like
Good
three
job, Monica.
3 out of the 6. And then my mom is tuning in from Miami, and she said Florida, North Carolina, California, Texas, Georgia, New York. So,
All
Ma,
good guesses, man.
you got 3 out of 6 as well. The correct
Yep.
answers are Florida, Alabama, Arkansas, Mississippi, Texas, and Georgia. So, out of the 10 states with the lowest access to mental health care, these 6 states have the highest rates of incarceration. Highest rates of incarceration. So we have got to do something to change that. We have got to do something to change that. Dr. Monica mentioned that you had a photo out with the governor, and she wants to know, is the governor going to fund this training for police in Florida? Now, I know you can't answer that. I know.
Monica, I am trying. But so far, we're not there yet. That's all I can say right now.
Yes. Well, hopefully we'll get there because this is much
But
needed.
if somebody's there watching from the governor's office,
I just say, call me.
call me.
Right. Yeah, for sure. So, so let's again around the trauma-informed care policing. Tell me, and you kind of alluded to what some of that looks like, but I think as we in the state of the society that we're in today, there's some trust issues. How do we maybe build some trust to try to kind of roll out some of this policing that you are suggesting or recommending?
Well, first we have to rehumanize the badge again, right? We need to be able to, for somehow, some way, law enforcement has lost their humanization behind what they do. You know, back in the day, police officers were loved and respected and appreciated, and kids would run up and I mean, they were like rock stars, right? I remember when I was a kid, I loved police officers. And even though I got in trouble and got arrested, it was a law enforcement officer that was a mentor that actually looked out for me and helped me to get to a position where I could be where I'm at today.
Okay,
So there was
wait. Did you say you got arrested?
yes, ma'am, 3 times as a youth and 1 time as an adult.
The police officer got arrested, y'all. Did y'all hear that?
That's right.
There you go.
That's right.
All right, carry on.
So yeah, so again, and not as a police officer.
I know.
This is my this is yeah, my younger days, right?
Everybody has a past, and even someone that has, gotten arrested, been in trouble with the law, can go on to be a member of, law enforcement. You know
Absolutely.
what I'm saying?
Absolutely.
Yeah.
Absolutely.
Mm-hmm.
So, again, I think it starts with training at the very beginning, at the academy level, teaching them the trauma informed care principles, helping them to understand that they're going to go to events, they're going to have experiences, and there's going to be effects, helping them to understand the different types of trauma that they're going to face day in and day out, and there's no way they're going to avoid it, helping them to understand that the trauma that's in their communities, helping them to understand ACEs. And then once they get out on the street, having field training officers in place that are trauma informed as well, that are there walking them through how to interact with people, the right types of questions to ask, the way that you show up, just all of the different aspects of trauma informed care, right?
Okay.
And then that's how we build trust in our communities. I can't tell you, Nicole, and you were there. You were there that day. We did the ride along. I've
Mhm.
had people that have told me I hate cops when I get there, and within 20 minutes of me having a conversation, they go, "You know what? You're different. I don't know what it is about you, but I want to hate cops, but I can't hate cops because you did something very unique. The way you spoke to me, the way you treated me, and it's all about humanization, right? It's about
Mhm.
humanizing the badge and helping people to recognize that behind our uniforms, behind that tough exterior, behind the duty gear and all that stuff, there's still a human being. And when
Mhm.
we can make that connection as a human, it helps to bridge the gaps in our community, to build that trust, and to reinforce what our role is and also what our community's role is as well.
Yeah, for sure. So Cheryl, who's out of Chicago, had a comment. She said, "I'm a trained instructor with yoga for first responders, and Illinois is the only state to give accreditation in mental health training. Hopefully, other states will follow."
Shout out Cheryl. Tell Olivia that I said hello. I love yoga for first responders. They're actually a partner with Going Beyond the Call.
Okay.
Olivia and Eric are just amazing people, and they do some amazing things for first responders. Working with them on the physiology side of
Hmm.
what we deal with, how to release stress in a positive way using yoga, and actually created yoga that was really focused towards first responders. So it was designed in a way that helps them to be able to release what they need to release, and do it in a way that connects with them. They've done an amazing job.
Wow. How neat is that? I didn't even know there was such a thing. So,
Yes,
yeah,
yes.
well, thank you for sharing it. So, what do you believe are some techniques or some tools that folks where you can use to assist with mental illness or poor mental health?
Well, I would say the first thing is getting training. And if your department doesn't train you, there's a lot of training out there. SAMHSA.org, NAMI, National Association of Mental Illness, all
Hmm.
of these government organizations have training programs. Valor, there's a program called Valor out there by IIR.
Hmm.
Again, they all have training programs. So don't sit back and go, well, if my police department doesn't train me in it, I guess I just can't get the training, because you know as well as I do that's false. If you
Hmm.
want to learn, you can learn. The opportunities are out there. You can come to Going Beyond the Call. We're putting training programs together to help people to understand the trauma informed care policing philosophy.
Hmm.
You can pick up the book. That book, in and of itself, is an entire education on trauma informed care policing, emotional state, ego states, the mitigation, understanding, awareness, and strategies to be able to deal with mental illness, to deal with mental health, and of course, to deal with your own personal wellness.
Absolutely. Absolutely. Now, you know, how in terms of crafting something that law enforcement could utilize for, or well, not just law enforcement, because it does say public safety professional. So
It does.
I would like to pause there and have you mention, that list of public safety professionals. Who does that include?
Thank you for that, because I was going to ask permission to do that. So you read my mind. Thank you.
Uh-huh.
First of all, why all public safety? Why not just police or first responders? Well, there's a lot of reasons, but the most important one is public safety as a whole is very self-destructive, and public safety connects with law enforcement, of course, firefighters, EMS, forensics, the guys that go around and do all the cleanup work and do the, put all the clues together for these, horrific crimes that they work on is unbelievable. Our dispatchers, right? Our dispatchers that are out there they are truly the first responder that takes the initial call that launches everything. They are dealing with people when they're at the top height of their emotional state because they're trying to gain control so they can get the information and keep that balance for our safety as well as the sanity of the person that they're dealing with. And then, of course, you got your corrections officers. I can't forget my brothers in corrections, man. And those guys probably have the least amount of training of anybody out there when it comes to dealing with the mental health aspects. And every single one of these, even though law enforcement is probably one of the most talked about, we're actually the lowest on the tier of all of those that I mentioned when it comes to suicides. In other words, firefighters, even though they only report about 40% across the board, across the country, have a higher rate of depression and suicide. EMS, higher rate of depression and suicide. Dispatchers, higher rate, depression and suicide. Corrections, higher rate, right? So when I saw that, I was like, you know what? We just need to make this for everybody in this industry and not just we could have done it where we could have made several books and several volumes and one specifically for each one, and we may go back and do that in the future. We are working on one specifically for law enforcement right now, but we may go back and do that. But for right now, I just wanted to get the information out there as quickly as possible so people could start digesting this content and wake up and realize that the mental health aspect of this is just as important as anything that you do physically on the job.
So let me ask you this. In terms of training public safety professionals, do you think that it's a one and done type deal, or it would be a continual education?
I think it's continual education because as we grow, and we learn, new things are going to be adopted, new treatments and new methods of healing and new findings on different surveys like ACEs and things like that. That information can change, and new opportunities to be able to serve and support are going to be coming out. So I believe that this will be a fluid thing where it will be consistent. As a matter of fact, I would go on to say it absolutely can't be a one and done. It has to focus on the officer all the way from the beginning of their career to the end of their retirement, even through their retirement, to make sure that we've done everything. And I'm sorry, but law enforcement organizations owe it to their officers to do the right thing and start addressing that this is a problem across the country. It needs to be a louder conversation that up to this point has not been had within our industry, and we need to do a better job of that.
Amen. 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 Very well said. So we are right kind of a little bit over the 30-minute mark, but I've asked if Sean will stay with us a little
Yes,
longer
of course.
for those who may want to, ask questions or have comments. But for those who may be just joining us, I have author Sean Wyman. He is a huge proponent of trauma-informed care policing and mental health wellness for public safety professionals. So that's what we're talking about today. It is Mental Illness Awareness Week. And what better topic to discuss than the mental wellness of our public safety professionals and the policing that law enforcement does in our communities. So, Sean, over these past 6-7 months, we've had a pandemic. We have had a lot of social unrest, racial unrest, as a result of several, how do I want to state this? Murders, killings of several African Americans. But I think George Floyd's death really kind of sounded the alarm around the country, around the globe. So I kind of don't even know how to formulate this question, but give me your thoughts, your sentiments on that.
Well, first, I think it's tragic when any human loses their life. Let me start by saying that. I mean, no matter what your past, it's tragic when somebody loses their life. It's tragic that George Floyd had a drug problem. It's tragic that he also suffered from mental illness. It's tragic that under those circumstances, the way that it went down, that this guy lost his life. Now, the challenges are still out there as far as exactly what happened. We all know that you see the officer and the officer's kneeling on him, and he's positioned in a place where I believe most officers would not have left him, especially under the circumstances, especially as his health declined dramatically. So I think that there's a lot of issues when it comes to training, and this is across the board, and unfortunately through these types of circumstances is how we learn, to not make those same mistakes. I know that from what I read, that position that he was in was a trained position that they had trained and they had utilized multiple times. And so it's devastating to see something like that for any human. Um, and it's frustrating, especially on our side, because there's so many of us that go out and we do our best to do the right thing every single day. And there are times that we get it wrong. And I believe this is one of them. And I believe that there will be judicial action. I believe obviously there'll be civil action behind this as well. And that department's going to learn a tough lesson. The officer's going to learn a tough lesson, and us as an industry, because when one officer does something, it doesn't just affect them. It doesn't just affect that agency. It affects everybody across the country in this profession.
Yep.
And so when there are other circumstances and you have that was so volatile, and then another one erupts, and then another one erupts, and then another one erupts, and then all of a sudden we've got civil unrest. And it's a horrible thing to see. I never again in a million years thought I would see a day where cities would actually be on fire, police departments would be set on fire, and here we are today, and we're seeing that almost on a regular basis now, and it's a scary thing. And I hope that we can come to peace with this at some point, somehow, some way, that there will be justice for the families of these people that have lost their lives, and also for the officers, because there are certain circumstances where officers have done the right thing, and they weren't given the credit for what they did, and they are looked at in the same light as other officers, and I think that needs to be sorted out as well.
Absolutely. Thank you for sharing that. So Cheryl had a question to you specifically about any suggestions on mental health trainings that she can take to get certified in to support her work.
Sure, I would go online, Cheryl, and I would look at trauma-informed care. Matter of fact, I'll just give a shout out to Florida State University, man. They have a amazing program that you can do online, and you can get certified in trauma-informed care, and you go through their process, and it gives you a certification. Of course, if you want to go deeper and you want to go into therapeutic, or you want to go into counseling, or however deep you want to go, there's lots of resources out there. I would recommend, if you look at CEU, so C is in Charlie, E is in Edward, and U is in under. Online, it's a accreditation of different programs, everything from trauma-informed care, social work, therapeutic, psychology, all kinds of different things, and you can do it all online for a really reasonable price. I got certified in trauma-informed care through CEU because Florida State didn't have their program at the time. My business partner went through FSU's program and absolutely loved it. She said it was spot on.
So since you've mentioned that, let's talk about like how you even got involved with, going down this road of getting certified and taking this training.
Well, it started with my own demons, right? Remember, I told you I had a very challenging past growing up. I was mentally and physically abused. I was abused by my stepfather from the age of 7 to 10. He was a drug addict and a drug dealer in the heart of Washington, D.C. At
Mhm.
the age of 10, I was one trigger pull away from changing my life when I premeditated and almost went up to the point of execution of killing my stepfather.
Mhm.
That led me into foster care. I was in foster care from until I was 18.
Mhm.
At the age of 12, I started drinking. I did a little bit of drug experimentation, but really alcohol became my vice very quickly. And
Right.
again, another trauma informed care lesson here. A lot of times we look at someone as an alcoholic and we go, look at that alcoholic, right?
Mhm.
What we don't recognize is what we see as a problem, they see as a solution. And
Mhm.
until we teach them that there's better solutions, they're going to
Yeah.
continue to follow the solution that's working for them in the moment. And
Yeah.
again, that's another thing that we can teach our officers that can help them to understand what they're really dealing with out there
Mhm.
instead of
Mhm.
just looking and going, oh, great, another drunk. Oh, great, another drug dealer. Oh, great,
Yeah.
another prostitute who's probably being human trafficked, by the way, right?
Mhm.
I mean, so again, it's really important to understand those things.
Mhm.
Went through the military, came out the other side of that after facing a near-death experience when I went through Ranger School and almost died.
Mm.
Got married at an early age. I mean, and so what I'm saying is I dealt with a lot of trauma all the way up until really 27 when I started my job at the Tallahassee Police Department.
Mhm.
And I'm not. This is something that I want you to think about. When you're in your worst moment and you need a police officer to show up, this is what showed up: a guy who hated his father or his stepfather, had never dealt with the fact that he almost murdered him, a guy that hated his mother because he felt like he'd been abandoned at the age of 10, a
Mhm.
guy who had grown up in broken homes and dysfunctional situations, went to multiple schools, started drinking at the age of 12 and drank consistently up to the point of when I showed up at your front door, I was still drinking. Was $100,000 to $150,000 in debt and child support and debt from a divorce, and a newborn father of a brand new baby boy, and buried in poor credit and trying to figure out how to become a police officer, right?
Mhm.
That's the guy that showed up at the front door, Nicole.
Yeah.
That's the guy, and that's what made me. And as I learned from that, as there were certain things that happened where people were saying things that made me realize maybe I can't hide my past, because I thought I could just put it in the back of my mind, forget about it, pretend like it never happened, and just drive on. And as long as nobody else knew, I could live. That's
Let
not
me
true.
let me pause right there. So
Yes.
did you feel like the uniform and the badge helped you hide from those things as well?
I'd hid from that a long time before I put a uniform and a badge on. I think the uniform and the badge drew it out because I had to go start dealing with people with the same experiences or worse than I had had. And
Mhm.
that forced me to go back and reflect on my own situations, when I was getting triggered in the moment when I was
Mhm.
dealing with people. So
Mm.
I would say that I had hit it well before that, but
Okay.
law enforcement drew it out of me because of the experiences and the situations that I was having to go into.
Mm. That's powerful, Sean. Again, I don't know if people are getting this, but if you could imagine the officers that you have to deal with or engage with, encounter on any type of basis, daily basis, weekly basis, or what have you, and them not coming to terms with their own experiences, what's showing up at your doorstep, what's showing up in those situations and circumstances, and what their mindset is in the midst of all of that, and how something that they are seeing that has nothing to do with them, right? From the standpoint of them being involved personally, can
Exactly.
trigger them. Okay, can
Exactly.
trigger them, take them right back to some adverse experience they had previously in their life.
And here's the other thing, right? You don't know what that officer went to before they showed up at your front door. For
Mm.
example, I went to a call just a few months ago where a baby died in my arms.
Oh
A
my God.
baby, a 5-month-old died in my arms while I was
Woo.
trying to give him CPR and revive him.
Mm,
An
mm, mm.
hour later, I'm on another call.
Yeah,
There's a problem with that, right?
yeah,
And
yeah.
look, I mean, there's so much growth, and that's the exciting part. Is there's so much we can do to get better, to
Mhm,
improve, to
mm,
even as simple as a supervisor going, "Hey, man, I know that baby died in your arms. listen, if you need to talk,
Yeah.
I'm here, right? Or if you need to go talk to somebody, or if you need to just take the rest of the day off, I
Yeah.
don't blame you, man. I know that's a tough thing to go through, and if
Yeah.
you need to take the rest of the day off, if go ahead, right? I
Mhm.
don't think, and that's, I mean, I've dealt with people that were shot, and an hour later, I'm on another call.
Yeah.
I've dealt with babies that have died,
Right.
and seen, quadruple homicides,
Yeah.
and the next day I was out working again
Yeah.
with nobody checking up and going, "Hey, man, I know that was a pretty gruesome scene that you walked into, and when
Mhm.
you flipped the light on and you saw what you saw, I know that was a pretty gruesome scene. You
Yeah.
need to talk to somebody. I'm here if you need me, right?"
Right. Right.
And so that's where we got to build the building blocks, and it's got to start with our young officers, because our young officers are going to evolve into our administrative staff. And
Mhm.
for the administrators out there to go, well, what does this got to do with me? Has everything to do with you, because you're the one losing money. Your
Mhm.
cities are losing money because every time an officer's taking a mental wellness day because they've dealt with too much and they can't take it anymore, right? You're being impacted by that financially,
Mhm.
right? If we go back and we were to look statistically at how much money is being spent on officers taking time off, just to take time off because they need that wellness day, what
Right.
does that really look like? When we go back and we look at how many officers got involved in unnecessary use of forces that could have been avoided, but they
Mhm.
weren't, how much money was spent? Because I know it's not hundreds of thousands, it's millions
Mhm.
on one use of force, millions of dollars being paid out.
Wow.
So think about that, administrative or administrators, as you're going, well, what's in this for me when it comes to this whole, trauma informed care policing has everything to do with you, with your budgets and how much money's being spent. And, if that money's not being spent on frivolous lawsuits, maybe some of that money can come back to you guys. You can reallocate those funds and improve your mental wellness programs.
Mm. Yes. Dr. Monica said taxpayers foot the bill, which is a heavy bill because it's not just a bill in terms of monetary, but it's emotional, it's societal in terms of trust and care and just the human capital on
Absolutely.
within the profession and outside of the profession. So it's a huge debt to pay. It really is. Ooh, that's heavy. That's heavy. That's heavy. But I'm glad we are having this conversation. I really am.
So am I, Nicole.
So, Sean, is there anything else that you would have us know about, mental wellness for public safety professionals, or about the trauma informed care for policing?
Like I said, I would challenge every sheriff, every chief of police, every attorney general, every governor to start paying more attention to the suicide rates in your states when it comes to your first responders and your public safety professionals, because it's higher than you think.
Mm,
And it's really, really important. And you can address this and you can set it on the right path. And it really does not take a whole lot to do it. It really focuses on improving where the funding is going,
mhm,
reallocating dollars to focus on mental health when they start in their academies or in their training centers, or wherever they're starting at, and implementing, whether it's trauma informed care, or something that improves upon their mental wellness.
mhm,
I highly, highly recommend that we start doing a better job of that. And we need to start doing that, because if we don't, we're going to continue to lose officers at a high rate. We're going to continue to have high divorce rates. We're going to continue to have high addiction rates of drugs and
mhm,
alcohol,
mhm,
and incarceration, right? Law enforcement officers that are getting arrested for domestic violence, right? We don't talk about those things because
mhm,
they're very quiet,
mhm.
but it doesn't mean that those things aren't happening behind the scenes, right?
Yeah, right.
Uh, and that's the challenge that I have for our administrators and for our government, is to really start to pay attention and look at the numbers for yourself. Hook up with Karen Solomon from BlueHelp.org, and look at the numbers. They're collecting statistics, right? They're collecting data and gathering information, and I want to say it takes up to 5 years to get a reasonable sample before you can actually put the information out there. It might even be 10 years, right? But they're collecting
Mhm,
the data now. They started in 2016, starting to collect the data on what's really going on. And don't get me wrong, guys, high liability is super important. It is life saving, and we got to have it. But don't you think that the number one thing that's killing us? Don't you think that that deserves to have some time and some response as well?
Yeah, for sure. For sure it does. Okay. Well, very good. Well, how I see you have the website as part of your name key, but how can folks reach out or connect with what you're doing?
Absolutely. Well, you can go to gbtc911.com if you just want to learn more about our program and opportunities for us to come speak or to come meet with your organization. Whatever the case may be. You can go to gbtcbook.com, and that will take you right to the book, Going Beyond the Call, Mental Health Fitness for Public Safety Professionals, and you can get your copy. You can go on Facebook, you can go on LinkedIn, Instagram. We're pretty much on all the social media platforms, and you can connect with us through there. You can email me at info@goingbeyondthecall.com.
Okay.
And I believe our phone number is on the gbtc911.com website as well. So if you want to call me, and yes, I am a human, I will answer my phone and I will have a conversation with you without automation. You can give me a call and I'll be happy to have a conversation with you.
Awesome. 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 So what's next for Sean Wyman?
Continue to keep working and fighting to get the attention out there, and hopefully with shows like yours and programs and networks and people that really want to see good change when it comes to our public safety professionals, and want to see improvements in our communities, that I'll be able to get their attention and we'll be able to get this training out there and start helping as many people as we possibly can, bridging the gaps in our communities, reducing liability, improving internal and external relationships, and most importantly, Nicole, saving lives.
Absolutely. So I'm going to put this comment up because I definitely want you to address it before we wrap up. I was kind of in wrap up mode, but Dr. Monica threw it out there. So she said, communities will continue to revolt. Cops must understand Black and Brown lives matter. Black and Brown lives matter. Do you think by and large, that message is something that rings true for, most law enforcement? Or you think there's some improvement that needs to be done in that area?
So first and foremost, when I swear my oath, I didn't swear it to one race. I didn't swear it to one sex. I didn't swear it to one age group. I swore it to all.
Okay.
I swore to protect and defend all people. So when I look at that, that's me.
Yes.
That's the way I look at it. I treat every human as I would want to be treated. And that's where my focus is at. As far as and what's going to cause revolutions and not cause revolutions, I don't know. All I can tell you is that I do my best to humanize who I am, to humanize who I am to the people that I interact with, and to try to leave them better than they were before. And I don't look at what color they are. I don't look at how old they are. I don't look at their sexual orientation. I don't look at any of those things. And I have been trained in the different biases, internal and implicit biases, and I do understand that those exist. And of anybody having a Black stepfather and a white mom, of anybody that could have had those biases, it would have been me.
Yeah.
But I have worked very hard to make sure that my mind is in the right place and that my heart, most importantly, is in the right place to interact and deal with people in the right way. So I serve and protect all people. And so I was raised that you love all people. And that's my stand.
All right. Well, again, I have witnessed it, and you can't go wrong with the golden rule, which is what you have just described. So
That's it.
I appreciate you. I am just super excited about your message and what you're trying to do. And I really, really do hope that this catches on in terms of, public safety professionals getting this much needed training and assistance to help them do their jobs more effectively and to help them be better human beings.
Absolutely.
So, kudos to you. And you know, you definitely have to come back and keep us abreast of what's
Yeah,
happening.
I would love that.
Yes,
And
yes,
Nicole, thank you. Thank you for being an amazing host, for having this awesome platform. Thank you to all your guests that watched, that commented. For those that are going to watch the replay, thank you so much. And I look forward to hearing your questions, and feel free to reach out. I would love to talk to all of you.
absolutely. There were some comments in the chat that we'll address because I think Cheryl was asking about some of those training resources that you mentioned. So we'll definitely go back and include those after the
Okay.
broadcast is over. But before we wrap up, I, you know, definitely have to thank the guests as well. Well, you as my guest, but also the viewers for commenting and having questions. This is really, really a great conversation and one that I hope we will continue. You know, one of the things that I say is that we need to keep conversations going. So let's continue to talk this up. Let's continue to bring it before, you know, the police and sheriffs, chiefs and sheriffs of the communities in which we live, work, and play. Let's bring this before our public officials who also have a say in this type of training being instituted. Let's bring it before our governors. Heck, you know, Dr. Monica was calling that out, you know, in this broadcast, how the governors need to get on board, and not just the state of Florida,
I
but
agree.
all those states that really have significant issues with mental health care and with the high incarceration rates, all of those states, all 6 of those states need to sign up for this. So let's continue to talk about this. Please like and share this video with your circles of influence. Also, Conversations with Nicole is on YouTube. Please subscribe to the YouTube channel. And this broadcast is actually live right now on Roku TV. So if you have a Roku TV stick or player, you can see all of the broadcasts every Thursday at 11:30 a.m. live in your living room on Roku via Greater Works Network. We just launched the network about a month and a half ago, and it's called Greater Works Network because we're about Greater Works. Sean Wyman is about Greater Works. So, you know, perfect title, perfect name for what we're doing.
Absolutely.
So, again, appreciate you, wish you all the best, and we'll have to have you come back really soon to catch us up.
It'll be an honor again. Thank you so much.
All right. We will see y'all next time on Conversations with Nicole.